our speaker. Dr. Amanda Hankins is a board-certified pediatric dentist. She attended dental school at the University of Tennessee and completed her residency at Baylor College of Dentistry. She is the owner of Sprout Pediatric Dentistry, a private practice in Northwest Arkansas. Dr. Amanda uses the Waterlase I+, Erbium Chromium YSGG in her daily practice for a wide variety of procedures in pediatric dentistry, and she'll be highlighting the laser during her presentation. Most importantly, she is a wife to Dr. Stephen Hankins and mom to Lennon, age 6, and Adler, age 4. Super cool names. So Dr. Hankins delivered a similar lecture at our second annual Tequila and Tongue Ties conference last April in Phoenix. It was very well received, and we're so excited to welcome her back on our national webinar platform this evening. So with that said, Dr. Amanda, it's your turn. So take it away.
Thank you. Good evening, everyone. I hope you had a good day at work today. I know it's late for some of you, so I'm glad you're here. This topic's a little bit different. I assume probably most of you have taken courses on what lip and tongue ties are, how to do a frenectomy, or even just how to use a laser in general. But tonight we're going to be talking a little bit more about how to actually implement this system into your practice. So applicable if you are starting a new practice, but also if you just haven't used a laser before and you're trying to generate that system within the practice that you already have. So I know at least back at Tequila and Tongue Ties, there were a lot of people that were considering buying a laser and curious on how to implement this, or maybe they just purchased one, or honestly, there are plenty of people that have one sitting in the closet. It's been there for a while. So what do we do? How do we get this all going? And like you said, we will have time for questions at the end. So feel free to ask any. That'll be great. I know he introduced me a little bit already, but I'll tell you a little bit more about myself. So like he said, I am a wife to Stephen Hankins. I'm a mother to Lennon and Adler. They're actually 7 and 5 now. They just turned the next age. So Lennon's in 1st grade and Adler is in pre-K, and he'll start kindergarten next year. But they keep our life fun for sure. I live in an area called Northwest Arkansas. Most of you are probably not familiar with it. It is honestly kind of like the suburbs, but without the big city. It is one of the fastest growing areas in the United States, which is really cool. If you don't know much about Arkansas, this is where the headquarters of Walmart is. So we have a lot of corporate style jobs that people have. And so that means a lot of private insurance. Everyone here pretty much either works for Walmart or some kind of vendor that supplies Walmart. So that is, I mean, that's good. There's a lot of insured patients around, but it does affect our treatment a little bit. But it also means that I do have access to a lot of different providers that I get to work with as far as the people that are going to be helping our patients. Some of you may not live in an area that has that kind of access. So I'll kind of talk about some options as we go along, but that may be something that you have a question about at the end. So I went to dental school at the University of Tennessee in Memphis, and this picture over to the right, that's my husband, Dr. Hankins, using me as a patient for mock boards back when I think I was like a D2 or something, but that was really fun, a cool part of our story. And then I did my residency at Baylor College of Dentistry. Some of you may know that as Texas A&M. After residency, I spent about, I think, 6 years as an associate at a multi-location practice. There, I was trained by a really awesome pediatric dentist, and that's where I learned to do frenectomies. Probably like most of you, I did not learn anything about a dental laser in school. I had never touched one. I knew the term ankylglossia, but other than that, hadn't learned a lot about this realm of dentistry. And so I learned most of that during my associate time. The office that I was at did a lot of myobrace, if anyone's familiar with that, different kind of myofunctional therapy things. But TOTS was just a big part of that practice. And so I learned a ton there. And I'll just FYI, I'll say the word TOTS a couple times throughout this lecture, and that means tethered oral tissues, in case you have never heard that acronym before. So about a year and a half ago, the summer of 2022, I opened up my own practice. It's called Sprout Pediatric Dentistry. It is a legit from scratch startup. Honestly, I never thought that I would have my own practice, but here we are. And so one of the big blessings of my times associateship is that I got to experience a lot of different laser types. They had a diode there, a light scalpel, which is a CO2, if you're familiar with that, a water lace I plus, and the water lace express, which is the smaller version of the water lace. And because I'd worked with all these lasers so much, I knew for sure that the I plus was something that would be a part of the practice I was opening and something I would want to invest in. It's kind of funny because my build out was done by Henry Schein. Like, they did all of the supplies and the equipment and stuff like that. And they partner with, I think, Soleil is the company, but they tried so hard to convince me that a Soleil was better. And it was just a hard and fast no for me. Like, I just like, don't even waste your time. I know I want an I plus. And I do, just FYI, use it for restorative treatment as well. And so I think that's another awesome thing to use it for. It's great for that. But I'll talk a little bit more in detail later about why I like the water lace so much. But one of the biggest things is just that it cools as it's cutting the tissues. And so I think that's great for treatment. But in general, like many of you, I was scared of spending a lot of extra money. I was already spending a ton of money, obviously opening a practice. So this was a big financial risk. So I knew that in order to cultivate the style of practice that I wanted, I needed to have a laser. So basically, I'm going to be sharing with you the things I did to ensure I'd get a return on this big investment that I was making. So in general, I would say there are 3 big ways that we get patients to our office. They are, one, either referred to us by a provider. They sometimes found us on the internet or social media or Google or something like that, or they were referred from a friend. Someone told them about you. So our topics that we're going to be talking about will be about how do we get patients from all these different sources. So kind of the outline is, first, the who, the people and the referral sources that we're going to be working with, how to build that network of referral sources, then how do we build the relationships with the patients that we're treating. And at the end, I'll show you a couple of successful treatments that we've done, some revisions that we've done in our office. You like that world spin? So first, the who. When we're treating TOTS in our office, we're getting referrals from a lot of providers that you're not normally working with as a dentist. So I think that's a cool part, and it's probably the biggest part of implementing this system is you're tapping into a whole new market of referral sources, and that's great. Big practice builder. This is so strange. I never thought I would say this, but my number one referral source is a speech therapist. So that's kind of cool. So here is a little diagram of the people that I would consider to be on my team for treating lip and tongue ties. And in general, I think it's really important for the success of your patient to have the team of providers. Very rarely will the release alone be enough for success. So who's going to be a part of this team? And this diagram shows my team. Yours may look a little bit different. And also in this aspect of your practice, remember that the team approach probably is going to often include support for the mother, because a lot of the people that we're treating are infants that are nursing. So first is the speech pathologist. You want to find a good speech pathologist that's trained in TOTS, and surprisingly, a lot of them aren't or don't even consider it very much. There have been multiple kids in my practice that I've done revisions on that have been in speech therapy for 5 years, and I'm the first person that even mentioned the tie to them. So that's important when you're searching for the right person. But if they are trained in it, they're going to often be the first person to even identify a tie. And then also we're blessed in the area that we're in, but a lot of the speech therapists that I work with, they are also trained in myofunctional therapy. They do specialize in feeding disorders, and they see a lot of infants too. Then you have your IBCLC, that's the lactation consultant. We also want to find a lactation consultant that's trained in TOTS. And if the ones around you aren't, then definitely try to go out and educate them. I think that's really important. Most of the hospitals around you where babies are born will probably have a team of some sort. And sometimes they'll even be connected with a pediatrician. So those are places you can look. In the area that I work, there's actually a privately owned business that goes to the family's home and does lactation that way. So that's really awesome. The parents love that so much. And then I've also known multiple midwives and doulas that do lactation as well. So those are different areas you can look for this provider when you're searching for the right person to work with. Then your chiropractor. The chiropractors, that I work with are seeing infants a lot, but older kids as well. They will do different kind of body work, pre and post revision. For infants specifically, a lot of times they'll need some type of body work just because of the position in the womb. Maybe they were breached for a long time or had a really traumatic birth. So sometimes they even have torticollis. So they're treating all these things and helping release tension, but releasing the tie goes along with that. Then the next is the pediatrician. They are probably most often the first person to identify TOTS, and hopefully they're doing that in the hospital, but that's not always happening, and sometimes it's missed, and that's okay. But the pediatrician's role is usually going to be monitoring weight gain, making sure milestones are met, and things like that. Then you have your OMT, that's a myofunctional therapist. I think, honestly, this may be the most important person on the team. So we definitely want to find one we can use. Their role is to train these release tissues to function properly. Sometimes after, even for older infants, so like 3 months and up, but even especially for older kids that have been living compensating for so long, it's really hard to relearn what they need to do. So the myofunctional therapist is playing an integral role in that part. I do think because this is a newer field, it probably is a harder person to find depending on where you live. So I know some groups that practice virtually. And if you have a hard time finding someone in your area, let me know and I can help get you in touch with someone that can do that virtually. It may not be as good as an in-person, but it's definitely going to be better than nothing. So keep that in mind. Then we have our orthodontist. This is probably more for older children, but you definitely want to find one that's interested in TOTS and how that will affect like the development of their jaws, the position of their teeth, and the oral resting posture in general. So you may refer back and forth with that person. And then the last person on this little diagram is you. You're what I would consider the release provider, and your role primarily is surgical intervention and focus on the healing. So that's our primary role, but I do know plenty of dentists that play other roles as well. Like some have myofunctional therapy in their offices and some also do orthodontics. So you can play multiple roles if you choose to. I also wanted to kind of briefly mention a few other people that we occasionally work with, just in case this is what's available where you are. An ENT. So for older kids, they may have airway concerns, and so that may be an important person from that standpoint. But at least where I live, dental insurance doesn't always cover this procedure. And so a lot of families will choose to go through the medical route because they can get it covered from their medical insurance if an ENT does it. So occasionally that's happening as well. Then a feeding specialist. So that person can often be a lactation consultant or an occupational or speech therapist, but they may be playing an important role if the kid is older and not tolerating foods at all. So that's something you may consider. And then one random, I guess it's not random, but I have occasionally worked with an acupuncturist. And so some of our infants that have needed a lot of body work have been seeing acupuncture as well. I'm honestly not super familiar with this, but the kiddos that we've seen have had great success. And so that may be something to look into as well. I need to learn more in that area. Okay, so we've talked about who should be a part of our team that we're using to help these patients, but how do we actually go about building those relationships? This was the intimidating part for me because I'm not necessarily I don't know. I don't really like to suck up to people, but this was just something I had to get right. It's like, I've got to make these relationships. They're not going to know who I am, especially starting a practice from scratch. So the first thing I did was start by creating just a basic referral that I could give to the providers to have. And you can see on here, it asks some questions about their symptoms. Are they noticing any particular tie? Then we have to kind of put in the work to find these people. So I've mentioned some ways you can look for people, but in general, I honestly started on Google. I started searching for lactation consultants in my area, speech therapists in my area, et cetera. And then I would look at their websites. I would look at their social media. If they're already invested in this realm of practice, then they will probably have information like that on those areas, on their websites and social media. But if they're not, that's okay. Proximity is probably important for your patients. And so I would also look for places that are pretty close to your office. And sometimes it's just a matter of educating them and helping them understand how they can be of help to the families as well. So like the orthodontist, you may already have some of these relationships, but a lot of them, like I said earlier, could be completely brand new. So I think it's important to set aside time to prioritize this. I personally, I took off some time between my associateship and my practice opening so that I could work on it and do this kind of stuff. But for most of you, that's not realistic or practical. So it may be something you do over lunch or on the day you're off or something like that. And once I found some people I was interested in making a relationship with, I would call or email their office and just say something along the lines of, hey, my name is Dr. Amanda. I'm a local dentist that performs frenectomy procedures. Is there a time I can meet with Dr. X to talk about how they can help serve our patients? If they said yes, we would schedule a time and do an in-person visit. I would go to their office, definitely take them a gift or some type of treat or something like that, because that makes everyone happy. And then when you're talking with them, we want to start with making sure they understand we know they're important. Their role is super important. We need them for our patients to succeed. So once you've established that, and then established that you guys have somewhat similar philosophies, you think you may make great partnership together, then there's a lot of kind of basic things I would talk to them about, very practical things for your patients. So for example, ask them if they take insurance. What insurances do they take? If you accept your state's version of Medicaid, is that something that they work with? What would it look like for your patient to actually get an appointment with them? Do they need to have a referral, or can they just call them and schedule a consult visit? Then how long would they like to see them? How many appointments did they expect? This one's really important, but does the provider want to assess the child before the revision's done? And honestly, I highly recommend that for most of them. The lactation consultant, speech, myofunctional therapy, it's really important that they get at least an assessment, if not do some work with the child before the procedure is done. And that same goes for the chiropractor as well. And then I would ask for their referrals. Say, hey, can I take some referrals of yours so that I can hand them out to our patients? Then once you've kind of taken the focus off of them, then you're going to talk a little bit more about what you do. Take some time to explain what you do. You may be wondering, they may be wondering, what makes your revision better than the guy down the street, especially if you have competition already. And in my opinion, this is why, because you're using a water lace. The guy down the street is most likely using either a CO2 or a diode. And then your ENTs and pediatricians are probably just using scissors and cutting that way, but you're using a water lace and they are wonderful if you haven't started using it already. Like I mentioned earlier, I've gotten the opportunity to use all laser types, and they can definitely all get the job done. But the rest of your team, they are who's going to be working with the families after the procedure. And if you can help the comfort level of the patient in the healing process, then everyone's going to be so much happier. This is a little, I guess, diagram that BioLace has made that talks about the heat that's generated in the different types of lasers. So I keep this laminated in my office, and I also took it around with me to the different providers that I was trying to build relationships with. And what it shows is the amount of heat that's generated when the laser's used. So that your CO2, that's the one on the top, that is the light scalpel. And so a lot of providers are using the light scalpel. It's way less expensive than the water lace. But in case you don't know the math, which I wouldn't have, but 500 degrees Celsius is 932 degrees Fahrenheit. That is really hot. And then the water lace at 14 degrees Celsius, that's 57 degrees Fahrenheit. It's a massive difference. So for me, I'm thinking pain levels, the damage to the tissues from the heat that's generated, tons of things are going to be better because of the water lace using water. And I think even with infants, probably a lot of people have questions about, can you use water? Is it safe? Yes, the answer is yes. I do use water with infants. I will turn it down. I turn it down to a 1, but I know some people will turn it down to just a 10. And so you may want to experiment with that and see, but we are suctioning the whole time as well. So I do like the water because it really does cool the tissues as you're doing it, and it keeps the site a little bit cleaner. You can absolutely use it with the water off, and it's still going to be way less hot, but that's something that you may want to kind of play with your water lace. And once I started working with some of these people that I did not know before, they would tell me how different the sites looked from the CO2, different from the CO2 laser. they were like, wow, it doesn't look so raunchy, honestly, for lack of a better word. And the infants especially seem to be a lot more comfortable. Then if you don't have pictures already, definitely start taking pictures. But I also would show them this picture of a frenectomy that I did. And you're seeing to the right, the immediate post-op of the procedure. So that tissue looks super happy, no inflammation, no bleeding. That looks awesome. But to be completely honest, this is definitely an outlier. They don't always look this way. But it's a great example to show you what the water lace can do. And so I always would show people that. And then the last thing I just added this slide because building these relationships is, like I said, super important for your patients. This is a social media post that one of the speech therapists that I work with did. And they had this little girl, she was 3 at the time, that had plateaued in her speech therapy. And they really felt like the revision was needed to release her tongue tie in order to make any progress. So the family came in for a consult. The girl sat in her mom's lap the whole time, like up on the bench, and just cried. She looked at me and said, "Don't stick it up my nose. Don't stick it up my nose." And I was like, "I'm not sticking anything up your nose." She'd just been COVID tested and obviously had PTSD over it. But we talked to the mom about it and everything. And we do offer conscious sedation in our office. And that was something we had talked about. But I was like, I'm just not sure how this is going to go. So I called her therapist and told them, I was like, I'm pretty brave. I'll try anything, but I just don't know if she's going to be able to tolerate it. Like if we can get this done. And so being the awesome people that they are, they spent, I think, 3 of her visits in therapy prior to the procedure, preparing her for the procedure. So you can see in this picture, they built this little thing that looks like a nitrous nose, had her practice laying down with that over her face, and really, really got her feeling confident and prepared. And honestly, we would have not been able to accomplish it without her, but she ended up doing great and it was a wonderful success. But this would have never happened if I hadn't had a strong relationship with these people. Okay, so next we're going to talk about the patient experience. So an important aspect of the frenectomy system in our practice is the patient experience. This is how I'm going to show you some recommendations of how to build great relationships with these patients and in their families. But keep in mind, as we go along, you can kind of divide our patients into 2 separate categories. I would say infants and non-infants. At least in my office, we handle them quite differently. So I'll talk about each. Specifically for the infant, you are treating a dyad, the mom and the infant. So it is a little bit different. So for the infant, I'm just going to give you kind of some basic tips if you're not doing this already in your office. But if you can, create a space that's in a closed room that's comfortable for moms to nurse. Ideally, it would be a place where you can't hear all the other people in the office, just so that they can feel a little bit private. A lot of these babies are newborns, and so it's good for them to not be overly disturbed. Maybe at the beginning of doing this, you offer free consults. I know a lot of providers that do that. And honestly, if you end up doing the procedure, you're really not out much by giving them a free consult. But if you don't do the procedure, if it's not recommended, then you've possibly gained a lifetime patient, or maybe their siblings want to be your patient. So don't be scared of doing that unless you're getting totally flooded with it. And I did start out doing free consults. We don't anymore, but that's because it's just gotten too busy. But I think that was a great practice builder at the beginning, especially for the referral sources, because they felt like good sending their patients to us because they knew they weren't going to be out anything for that appointment. Random, but I keep a little space heater in that room because it can get kind of cold, and a cold baby is usually a mad baby. And I also keep a couple of little toys because often the family brings along the toddler siblings and they can be really distracting. So I have some toys in there and some books for them to play with while we're doing the consult. So when the appointment starts, my staff will spend about 10 to 15 minutes with the parent before I come in. And then I'll come in and talk with them for another 10 to 20 minutes. First thing when you go in the room, congratulate the family. They are new parents, and especially if they're first-time parents, which you may be able to see this, but that's one of the questions on my assessment. So I think that's really important. We want them to know we're excited for them. This is an awesome time in their life. And then I'll go over the assessment with the parent. I'll just briefly, it has some questions about, did they have vitamin K, about the birth itself? Was it traumatic? What are the current feeding practices like? How frequently are they feeding? How long does it take? How many ounces are they drinking at a time? And what type of milk? And then we'll go on to the symptoms. Then I'll do a clinical assessment. And during the clinical assessment, I always try to let the infant suck on my finger. I will say the younger babies will do this better. Once they hit that 3-4 month range, they usually don't. But if they suck on a pacifier, I'll try to watch them do that. I just kind of want to see, like, is the lip tucked? Does their chin roll well? Can you see them consistently sucking? Things like that. If they'll suck on my finger, I'm actually feeling for, are they holding a suction? Are they biting on me? Is the lip curving on the sides? Things like that. Is the lip tucked? And then I'll kind of describe what I'm feeling to the mom and ask them if it's the same. It may not be, because they're obviously not nursing, but those are important things to kind of be looking for. Then I'm assessing the ties and taking pictures. We may or may not see one, but I'm going to use that photo to describe it to the parent. It's really hard for them to see in the mouth while you're in there. I mean, they're not trained like we are. And so I usually will use the photo to describe to them what we're seeing and where the attachments should be if they're not already there. But another important part of this consult appointment is considering, does the infant need to see another provider first before the procedure's done? And the answer is most likely. Sometimes at my office anyways, they've already seen someone. That's how they got there. That's probably more often the case, but other times they just found us on Facebook and they don't know what they're doing at all. And that could be a super useful step for the parent and the baby before the procedure to maximize your results. And then I always try to remember too, the more I'm referring to these other people, the more likely they are to refer back to me. So then after the assessment's done, and if the procedure is recommended, we will go over the post-op instructions with them. All this is reviewed before any treatment plan is signed or anything like that. Most likely the parent's primary concern is going to be, is this going to hurt my child? What is healing going to be like? You know, what do I need to expect? But going over this really will help them feel comfortable. I like to give them expectations on exercises and the discomfort. From my experience, most of the infants will be noticeably uncomfortable for at least the first day, if not up to 3 days sometimes. So we want to be honest with them about that. Like you will notice probably that your child is a little uncomfortable. And then I have some things on there that they can use if they feel comfortable doing that to help with the discomfort. For super nervous parents, I'll share with them that same chart that I showed you about the heat generated by the water lace, and just let them know, hey, this procedure's really going to benefit your child. This is definitely the best way we can do it. That usually will make them feel really comfortable. And if they feel really nervous, more nervous, then oftentimes I'll talk about my own experience with the laser, and I have used it on my own mouth multiple times. It feels like a really strong shock, and I don't like it, but I can still do it to myself. So that does at least give you an idea of the pain threshold generated. I don't personally use any kind of anesthetic with infants. And so I think their parents are always asking this kind of question. And then lastly, post-op visit. I highly recommend you do a post-op visit at the 1-ish week mark. Some people do it a little bit earlier. Some people do multiple. But I think at least one, that's super important to check on the healing and make sure they're doing the stretch as well. There can be a lot of regrowth happen even after the 1 week mark. And so if we need to modify things, that's a great time to do it, because we can still intervene early enough to make sure that they get optimal results in healing. And then here I just added some photos of some things that I use, some practical things you can have or look into getting if you're interested. The board on the left, that is a board from Specialized Care Co. I use one for the consult and for the treatment itself. Then I have these glasses from Innovative Optics. So the goggles are for the infant, and they just kind of tighten around their head. And then I wear loops. And so this is a loop insert that is a laser safety eyewear that I use. And honestly, it's bulky, but I think it's better than me wearing glasses, because I really like to wear my loops. And I tried putting the glasses on over my loops, and that was worse. So that's what I've settled with. And then a few different swaddle types. They basically go from smaller kid to bigger kid. So the one to the far right, that's called the Lase swaddle, and that works really good for older, bigger kids. So that's important and helpful to keep their arms from going up into their face. And then I think in general, one of my biggest practice builders has been that I'm not trigger happy. To me, the answer is not always to cut. And that's important. Not everyone can benefit from this procedure, especially infants, when we're putting them through something that's hard for them and the parent. So I think that the providers trust that I'm going to be honest with them. And if you guys know who Dr. Linda Dancer is, she's one of the BioLase trainers, but she has a saying that goes, I don't see a predictable benefit. And I really love that, because if we don't think it's going to fix their problems, or they may have certain goals that they're trying to achieve for their child, then really what's the use in putting the infant through it? It's a big commitment for the family, even just the stretches themselves. So I try to be very reasonable about expectations and when to recommend the procedure. So a lot of you, like if this is new for you, you may be concerned a little bit about how quickly the infant treatment could actually take off. And sometimes, honestly, that can take time because it's a totally new thing. But if you aren't already bringing in infants, don't worry. I promise you can find these people within your practice already. So basically, you'd be building the system from the inside out. So in that case, your first step is probably going to be at a new patient appointment or even at recall appointments. And to the right, I have a questionnaire that I have all of my new patients fill out. It's called the Pediatric Symptoms Questionnaire. And it goes over different things about breathing and sleeping, their diet, any kind of habits they may have, speech development. So it's already giving me cues of, do they have signs and symptoms associated with lip and tongue ties before I actually even look at the patient. If we notice things, or the parents come in asking questions about this kind of stuff, then that's great. But sometimes it's honestly completely foreign to them. They filled out this questionnaire, but they're like, I don't even know what any of this means. So if I notice a tie and it's foreign to them, then I will just kind of plant a seed and just say, hey, I noticed this, and then go over some of the questions. Have you ever noticed any kind of symptoms, and go over this questionnaire, like things they've checked off or haven't checked off. And I'll spend some time educating them, but I don't want to be overly forceful because sometimes that can really turn people off. But I'm kind of just planting a seed, and I usually will end it with, we'll probably talk about this every time you come, but it's just something that I want to make sure we're aware of, we're monitoring. And just so you know, we do offer the procedure to correct that if you're ever interested. On the flip side, if the parent actually acts interested and it's something that they're wanting to have treated or evaluated further, then I will say something along the lines of, why don't we take some pictures and we'll send it to your insurance and see if it would be covered? And because they usually want to know, like, how much is this going to cost kind of deal. And I do work with insurance companies, and we do a lot of pre-approvals for the treatment, but that may not be how your practice does it, and that's okay too. But in general, if you do decide to proceed, or if the parent does, then don't forget, they may need to see someone else before the release is done. And so that's important. So in general, though, when you're doing these evaluations, if you start evaluating for a lip and tongue tie in every patient that you see in recall, I promise you'll see them everywhere. Once you see one, you'll see them every day. Another little tip that I think is great is to make a section on your website that will educate the patients about this. You can put some cases on there if you have good photos. You can also put things on your social media. So if you don't have any photos yet, start taking them. That's great. It doesn't take long to get something good, but you definitely want to have this somewhere for people to see. This particular website that I took a clip of, this is my friend Kevin Kennedy. He practices in, I think it's Clarksville, Tennessee, but his website is so good about lip and tongue tie treatment. So just you should go check it out and just kind of see what they've done for their patients to see. And then last, I just wanted to show you some examples of successful revisions that we've done in our office, things that have gone really great for us. So this kiddo was one of our first patients to come, I think, like within the first couple of weeks of opening. And I think he was 11 at the time. I noticed just when he opened his mouth, you could see the tongue tie. And so I had him do some different tests and evaluation. And you can see in this photo that the strength is just not there. Like his tongue is super weak, kind of sloppy use of it. But according to mom, he didn't have a lot of significant symptoms that she'd noticed. But once I showed her, she was really interested in having it corrected. She was just kind of one of those moms that just wants everything to be perfect. And so she showed a lot of interest. Well, we started doing some myofunctional therapy, and we did a little bit of work with that before the procedure. It was covered by our insurance, so she wanted to do it. And then he did some more therapy after the procedure. And like I said earlier, I do a follow-up visit at the 1 week mark. And when they came in for their post-op, he was doing well. He had been a little bit sore, but it wasn't too bad. And the mom told me, she pulled me aside and she's like, he doesn't use baby talk anymore. And I was like, huh? She said, I just thought it was cute. I didn't realize he was baby talking because he couldn't articulate his words. And so that was just a really cool and encouraging thing. Mom didn't even realize he was having symptoms over it, but it corrected something that could have affected him later in life. This is cool. It's cool because I did this so early on in my practice that we got a follow-up or a 6-month follow-up, but the healing looks so good to me in that picture. That's great. Also, you can see in the middle is the immediate post-op. So that is probably one of the smaller revisions that I've seen. And you can tell that in general, the tie looks thin, which is great. When they're thin, that's always great. But sometimes they're going to be a lot wider than that, a lot bigger, and they all look different. And I try to set the parents' expectations based off of what I expect it will look like. But this one wasn't too sore. Sometimes it's a lot bigger and they'll be more sore. So don't be alarmed if everything you do doesn't look like this. Then here's a couple of pictures of lip ties that we have done, that we've had some good follow-ups on. These are both around 5-year-old girls, and neither case was it causing a diastema, which is what you typically expect to see. It was more of the child had a inverted smile. So you could see when she smiled, the tissue made an inverted triangle, and the mom really didn't like the way that looked. So I will say in general, it was more of an aesthetic thing for the family, but it was definitely pulling the lip down, and she had some blistering that was always persistent right in the front of her lip. And so they wanted to do the procedure. You can tell on the left side, but the upper right of that one, that's immediately after the procedure. And it did bleed some. And I would say that's fairly common for the lip, especially because of when you get closer to the actual lip itself, you will see some bleeding occasionally there. But that's fairly normal. It clotted well. And then the bottom picture is a week after. So that's great to see. You can see a little bit of scab hanging on that eventually peeled off, but it's healing really well and looks really nice. And this patient didn't have a lot of discomfort. But then over to the far right, you can see 8 months later, and it's like it wasn't even there. So it's kind of cool. A good thing to see. And then for this slide, this is my daughter, Lennon. Because I love the water lace so much, I wanted to do like a little diagram with her of the frequency, or I guess shorter intervals of what it looks like with healing. So she was kind of like the girl before. It wasn't a big spacing issue, but you can see the frenum was showing down, but it came down all the way between her teeth, and we could see it in her smile. Her dad had already had a frenectomy, so we just, before permanent teeth came in, we were kind of like, we want to go ahead and do this and correct it before the permanent teeth come in. And she had lost her bottom permanent teeth, or bottom baby teeth, sorry, at this point. The first picture you see, I don't know if y'all use topical, but she was a little sensitive to the topical. That's why the tissue looks a little sloughed, because I took that after the topical was on, but it didn't look like that before. But she was super sensitive to the topical, so be careful there. But yeah, I did kind of slough the tissue a little bit, so that's not the best picture. But you can see to the right, the immediate post-op of her, no bleeding. That site looks wonderful. It's really cool to see kind of that periosteum layer underneath. And then the bottom left picture, that is 2 days afterwards. So her scab's filling in. And then the far right picture, the bottom right, that is 4 days after. So it's healed in a lot. And we did use some things to help with the healing process, but just to see what the water lace can do and how gentle it is to the tissues, I think is really cool. So just to conclude, I wanted to encourage you guys, you can totally do this. This is a fun little I guess, grid that I made. So like I said before, I was nervous about the cost that I was investing into the laser. I knew it was something that I wanted to do, but I was nervous about it. And so I did the math and I made this little grid. If I fill up all these boxes, then I've paid for the laser. And I opened June 1st of 2022, and it took until January 2023 to fill it up. So not terribly long, but it was a good, encouraging and motivating way for me to just make sure I was getting a good ROI on this laser. And you definitely will. One of the biggest recommendations that was made to me is literally get it out every day, set it up every day. If it's there, you're going to use it. And so that's important. But just FYI, I haven't paid it off yet, but that's because interest rates at the time were super low. And so I'm just going to ride that out. But it's definitely paid for itself quickly, and I couldn't practice the same without it. I'll turn it back over to you, Joe.
Thank you, Dr. Amanda. Great lecture. We all remember the days of the low interest rate that are no more.
Yeah.
So, but thank you so much. That great content, great lecture. We do have a few questions for you that I wanted to go through. The first one, so you showed that slide with a couple different products and swaddles to the audience, and there was an audience member that wanted a reminder about the name of the specialized care board and where they can find it, and then the manufacturer of the laser loop insert.
Okay, so the specialized board, the company is literally called Specialized Care Co. Their website is specializedcare.com, and they make things like papoose boards and stuff like that. They make a lot of things for special needs kids, the mouth props, but that's where those boards are from. And then you said the loop inserts. That company is called Innovative Optics, and they make all kinds of laser safety goggles. There's tons of options, and they'll even send you samples and let you try things. That they were really great. They sent me multiple, let me try them before I decided what to buy, because they are kind of expensive.
Right. Yeah. And to our audience, Innovative Optics is an extremely reputable company that provides laser loops and the goggles for infants and children for all laser wavelengths, or for the majority of laser wavelengths. So I believe their website is just simply innovativeoptics.com. If you Google them, you'll find them, and they have great service and good products.
Yeah. For my assistants and everything, they wear the ones provided by Lase. We have a bunch of those, but it was just for me to be able to wear my loops. That was the main reason why I got those.
Okay. Good point. And if you're not a current laser owner, that is a good point, that when you do invest in the laser, you receive laser goggles for yourself, and then for, I would call it a larger patient or an adult patient. But so for children, you would need to invest in goggles or some type of protective eyewear.
Some people that I know use the little eye tape type things that they use in the OR. I don't know what they're called, but I know people use those too.
Yes, I've seen those as well. There was a short question here. Do you numb for your frenectomy procedures? I guess, when do you numb? Maybe when do you not numb?
That's a great question. For infants, I don't. That's because I'm a scaredy cat and I just want to be safe. So I don't at all until age 2. And I guess if they were closer to 2, I might use some topical. I've only done one that age, and we did not numb because the parents didn't want to. But anyways, if they're over 2, I do. And so I'll use topical first, and I do have I use a compounded topical. And then I put just a little bit of lidocaine in there, just honestly, right into the frenum, both the lip and the tongue. I've tried more than once to just use topical, and every time they feel it. And so I just started doing that from the beginning.
Great. Thank you for that. There was a question just about your new patient paperwork. I think the best way to phrase this would be, you have a newer office there. So how did you go about creating your new patient paperwork? Do you have any resources that you can provide to our audience about how they can create their new patient paperwork, anything you can provide.
Yeah. I mean, if you wanted to reach out to me personally, that maybe this will have my email or something attached, but I'd be happy to help or at least show you what I have. What I did, I went to multiple offices, like people that I know, and went back to actually Dallas and worked with some people that I know and just shadowed their offices, and they let me kind of compile different things together, and did it that way. Honestly, if you search online, a lot of good websites that are doing this will have them on their just on their practice website. So you can definitely find things online that are helpful and just see what's suited best to you, like what you care about, what you think is important. But I'd be happy to share my stuff if someone wanted to reach out to me personally. It took a long time.
What's the easiest way for someone to reach you, Dr. Amanda?
Yeah, my email is Dr. Amanda, just Dr. at sproutpd.com.
Okay, and I'll share that again. So Dr. Amanda at sproutpd.com.
Yeah.
Okay, a couple others here. So this question, when doing water lays or when performing the procedure with water lays, there is, as you mentioned, water spray.
Mm-hmm.
So how can you manage water in the infant's mouth safely, especially while the infant is crying?
Yeah. So for when we are doing the lip, we use a high vac suction, and I have the ones that are the opening it's more open on one side than the other, and so they literally hold it right under like that. So it's pretty much collecting all the water. The assistant, because I have two assistants to help me, one that holds the child with me, and then the other that's only suctioning. And so they're holding the high vac for that one. And then if they need to go in with a slow speed, like in the back of their mouth, they will. For the tongue, I'm lifting the tongue, and they are holding the suction, the slow speed suction for the tongue behind it. I have tried to use the high speed suction for the tongue, and it just sucks the tongue up. So it kind of interferes with the procedure a little bit, it from my experience, but that's how I do it. And like I said, I turn it down to 1. So when you use your laser settings, you can modify the water from 1 all the way to, I guess, to 100. It's automatically set on a 30. And I do use the regular settings for older kids. It's just the infants that I turn it down. Occasionally, if you have like a severe gagger or a kiddo that maybe has laryngomalacia or something like that, then I will turn the water off. But you can tell, like, it starts to stink. It's definitely harming a little bit more than with the water on. But sometimes I do that just for safety purposes.
Great. Thank you for addressing that. I know that's a big question for a lot of prospective users that are shopping for lasers, and even our current users that are learning how to use the laser. It is called water lays. So I know that's a concern for some people about what to do with the water. So thank you for addressing that. Last question here, one of the last questions. Could you recommend any courses to learn more about tongue tie release? And I'll address some on the BioLase education side, but maybe some things that you've done, Dr. Amanda. Are there any vital tissues that we should be careful? Let's address that one first, and then I'll ask the second one.
Yeah. So BioLase itself has lots of good ones. If you have not purchased a laser, part of purchasing one comes with an in-office training. So one of the trainers will come into your office and you get to practice on a pig jaw. But what I did too is I set up multiple patients to come that day, and we did free treatment. We did fillings that day. We did multiple lip and tongue tie treatments. And so I could work with the trainer and do those things in my office and just kind of see it in my own environment. That's a super cool resource that comes with buying the laser. If you need to do something before that, there are BioLase, and I'm sure you'll mention, but they do have specific classes that are in person just for usage. I have taken a class from Dr. Kotlow and learned more about like the diagnosis side and assessment from that. And then I think most of it's been hands-on. With all of my hands-on training has come through BioLase though.
Okay, great. Yeah, and to our audience, I'll review a couple more details about BioLase education here in a minute. Second part of that question, are there any vital tissues that we should be careful of when doing frenectomy on infants?
Yeah, they're the same as on older kids though. The vessels obviously under the tongue and you can get to some kind of closer up to the actual lip itself when you're away from the gums. The salivary glands, I think that's probably the most important one to be really careful with when you're doing the infants, especially under the tongue if it's super tight. So it's a small space. That's what makes it hard. It's just the space you're used to working in has decreased in size significantly. I actually had my first patient, I think it was yesterday. We used like this little, we call it a Mickey Mouse ears. It's a tongue retractor to hold the tongue up while we're lasering. Well, it didn't fit in their jaw. Like their lower jaw was too narrow for it to fit. And so it was super duper challenging to access. But those are the main things I would say you're looking out for: vessels and your salivary glands.
Great. And we had one last one come through here. So when a parent comes to you without a referral, which of the other providers are you referring to for additional evaluations and involvement?
Oh, that's good. Okay, so for infants, if they haven't seen a lactation consultant, that's going to be usually my first place to go. Occasionally, the parent is already bottle feeding. They are not interested in nursing, and so they don't care about that. If they're really having a hard time with it, then we have, like I said, speech pathologists that do infant therapy, basically, is kind of what they call it. And so I'll have them see them. But ideally, it's a lactation consultant first, because if the mom's goal is to nurse, then we really do need to be working with someone who specializes in nursing. For older kids, it's more often a myofunctional therapist. And we do some of that in our office. And I know some people probably do more than I do, but that's kind of where we're going there. Or if they have speech issues, then a speech therapist. Those are the main things that we're probably sending to before release is done.
Okay, great. Well, thank you for spending some time here at the end to address everyone's questions. And thank you to the audience for posing your questions to us. We hope that you found the lecture tonight valuable and meaningful for you. And before we completely wrap up, let me just go through, per our topic a second ago, just some educational opportunities to learn more about tethered oral ties and the erbium chromium YSGG laser, i.e. the water Lase laser. But let me start with tequila and tongue ties. As I mentioned at the beginning of the session, Dr. Amanda presented at last year's tequila and tongue ties in Phoenix. We've done these conferences for the past 2 years, hence the name. You can imagine it's a very fun conference, fun time. We work a little bit, we play a little bit, but I did want to spend a little bit of time just letting the audience know that we are planning the 2024 Tequila and Tongue Ties to be in Miami. So we're coming east this year. And our education and events team is working to schedule that in April of 2024. And we should have the dates and the venue and the registration links set up, and we'll begin promoting that here in the coming weeks. So please be on the lookout for that if you would like to join us in 2024 for Tequila and Tongue Ties in Miami. To learn more about courses and webinars and all sorts of educational resources, very simple website that you can go to, education.biolase.com. And when you go there, and even if you go to biolase.com, there's education right there at the top toolbar. But Water Lase Academy is, kind of that home base, that one-stop shop for all things, resources. You can watch videos, watch cases, read research articles, sign up for future courses, etc., all through this website. One of the things you'll find are Water Lase clinical animations with all sorts of clinical animation videos, including the frenectomy procedure. So you can go there and watch those clinical animations along with live case not animations, live case videos as well. There's virtual education on the web on that site. So you can sign up for our future live webinars, on-demand webinars. So tonight's webinar was recorded, and we record all of our webinar sessions and post them onto our library to view at a future date. So if you wanted to rewatch this or you missed something and wanted to take down a note, we'll have this posted on our on-demand webinar library probably in the next 2 days. So be on the lookout for that. And then lastly, we do have a really cool podcast series. If you're not familiar with it, it's great content, great information to learn about laser dentistry, anything from pediatrics and tethered oral ties to we have a great podcast on there about how to use the laser in oral surgical procedures, perio, restorative, you name it, it's on there. So it's a great podcast you can follow and keep up with. In-person courses. So we have our Waterlase foundational courses, and you can read our learning objectives of that course on our website and find future course dates. But also, if you're in our audience and you're a current laser user and are interested in advanced courses, we're working right now to build out our 2024 course schedule. So be on the lookout for dates for next year, and you can take a pediatric course. If you're interested in other areas of dentistry on how to use the laser, you'll see the list there. And if you click the little plus sign on the website, it actually shows you some of our learning objectives of each course. Our next webinar is coming up on November 7th with Dr. Brad Labreck. Again, you can register for our webinars at biolase.com/webinars. And this one is going to be focused on restorative dentistry using the Waterlase, using the erbium chromium laser. So here coming up in the next couple weeks, we'll be unveiling a new restorative guide using the Waterlase. And so this webinar will be in support of that guide, and Dr. Brad will go through kind of a step-by-step approach of how to easily use the Waterlase in your restorative care. So this is recorded, great content again by Dr. Amanda. So if you would like to rewatch it, it'll be posted in the next couple of days, along with all sorts of other webinars we posted on biolase.com/webinars. And our team at Biolase Education is happy to help answer any other questions you may have. You can email us at education@biolase.com. And so with that, Dr. Hankins, thank you very, very much for your presentation and answering everyone's questions. I thought it was wonderful. We appreciate your support of our technology, and great to see that your practice is thriving there.
Thank you so much.
And to our audience, thank you for joining us, and we hope that you'll be back on November 7th for our restorative webinar. And with that, I hope that everyone has a wonderful rest of your evening and week. Thank you.
Good night.